And here on the main stage, we will have boosting collaboration in a large hospital. So I will call the Lean Institute from Netherlands.
Hey,
René.
Chris. Hi. All well. Thanks to Christopher Roser. Really interesting blog he has all about lean. And we're going to talk about one of the biggest hospitals in the Netherlands, in Rotterdam, the Erasmus Medical Center. And we are fortunate that we have Dr. Kjeld I, who is the director of one of the biggest parts of the hospital, together with Stefan Visser. Stefan is one of my colleagues, and he is currently working as an interim manager, helping Kjeld to make the hospital work more efficiently and more effectively. It's up to you guys.
Okay, thank you. Thank you for having us. And hopefully we will give you a little bit insight in our hospital. Kjeld?
So we like to take you on our journey, the next 30 minutes, on our lean journey in our academic hospital, Erasmus Medical Center. To give you some context, it's a hospital with over almost 14,000 employees. We have a lot of students, academic students. We have an annual budget of 2 billion. So it's in Holland, in the Netherlands, the biggest hospital. So we have a lot of work, but a lot of opportunities to introduce lean thinking and working in our environment. I think I want to start with 5 minutes context of the Dutch healthcare system. And I think we have a problem, and I call it a value crisis. And it was already in place before the COVID crisis starts. And a value crisis because we see a lot of problems in the Netherlands. I think some of the problems are universal, but we see the quality and accessibility, but also the affordability is under pressure. We see a growing demand on healthcare services. We see labor shortage. We see a lot of fragmentation, not only in our healthcare system, but also in the IT systems we use. So a lot of challenges. And one of the things we also see has all to do with trust. And my thinking on that topic is that there's erosion of trust, not only in politics and government. You see it also in society and also in our healthcare system and in our hospital. We have a lot of discussions. What's the right thing to do? Can we trust our leaders? So on that background, a value crisis, we have a lot of effort to do to add value to our processes, to our patient care. We have erosion of trust. We started actually on that background with lean thinking. And I like the idea of this slide: unchanged thinking leads to recycled experiences. And we see a lot of problems in our healthcare system in the Netherlands today because we don't change our thinking. And one of our experiences in our hospital is that lean brought a different perspective on things. And I think that a new way of thinking is necessary to experience different experiences as well. So maybe as a start, I think lean is crucial to our organizational long-term success. And it not only helps people to grow, it's very important. Actually, when I started with lean, I thought lean was more a kind of tooling, but actually it's all about people. Lean helps to improve your productivity, very important. But in the end, it helps also to solve problems and helps to restore trust within the organization. So from that perspective, Stefan and I, and also René, from the Lean Management Institute started to think, okay, what can we do to introduce Lean more as the strategy and more as a new way of thinking to restore trust, to solve problems, and for sure to improve productivity. And we called it a WAVE program, and Stefan will explain with examples a little bit more. Here you see one of actually my Obea room. It's actually in this room where we are doing this broadcast as now on the background. And you see we focus on people, safety and quality, and service processes, and also as a result, we look at the costs. So, Stefan, can you take the audience on our journey? What actually did we do in last few years?
Okay, thank you. So now what you can see in the OBEA that Kjeld together with the management team, we look at what are our goals. And if you look to the right, you can see a little bit some A3s. And the background of the A3s is that we started up with a WAVE program at the Erasmus MC. And a little bit background is our WAVE program is based on what can we do to have a kind of a operational management system in place. And like you have seen on the board of Kjeld, we look at patient value in this case. And what are the most important things where we can work on, especially based on the safety, quality, delivery, cost part. And I think one of the biggest things we have achieved with each other is based on visual controls. And what are the goals we would like to achieve with other people is that we have lean leadership and real lean on the shop floor, especially on what do we need to do to have problem solvers in place. And one of the biggest things we saw is that not always we have basic stability in place. So from that point of view, what can we do to improve things? And just from starting from the basics, it's also important that we always have a kind of continuous improvement environment. And it starts with, okay, if we are talking about lean, what is lean, especially if we are looking at a healthcare environment? So what were the modules? I think what we did is in the morning, we have some theory. And in the afternoon, sometimes people have something like, okay, if I'm working in a hospital, lean is about cars. So can you please help us to use this kind of theory in an environment as ours? So what we did, Kjeld first built his OBEA, and from that point, what we did is, okay, what can we do to change his OBEA into a kind of an operational management system in our care units? And if you know what your biggest issues or problems are, what about the processes? So day 2 or module 2 was about value stream mapping. And looking at all the processes, where are our biggest problems to solve? And okay, now we know what our problems are, and all the people are start to make in A3. And from that point, if you're talking about basic stability, what do we need to do to have standardized work in place? Job instructions, what can we do with that? I will give you a little bit example later. If you have your job instructions in place, how can we see that we are improving things? So we did a lot of visualizations. Also 5S, so people search here in the hospital every day, they are searching for their equipment. Okay, if we have this in place, what do we need to do to have a continuous improvement environment? And then we go a little bit deeper on Kaizen. And on the end, because this is one of the most important things we have to solve in the Netherlands, it's about leadership standard work, especially on discipline. Because most of the time, the people in the Netherlands always know it's better. So, and discipline is a little hard for them. So I think this was one of the most important modules they have to work with.
What I like on this program we introduced is it's not only about knowledge, but after a knowledge session, we go to the workplace with the trainees actually to install and to develop on the spot with coaching on the job, for example, an improvement board, or we started discussing with each other how can we organize our patient visits, for example. So Stefan will show some examples, but I like the combination, short knowledge introduction and then coaching on the job to actually do what you have learned a few hours before.
And also in between, we have some coaching days, so we can help people to do it better. So we started at 5 care units. Here you can see the different specialisms we are working on. I think we have a total of 350 nurses working in this area, even, I don't know, maybe even more.
Yeah.
So we started up first with the training of 30 nurses and 10 team managers, especially for the lean leadership part, because this is very necessary. So they have to learn it first by themselves if you would like to achieve something together. And at this moment, we are training the same number of employees because we would like to have as much problem solvers as possible. And because of this Greenbelt training, we have created more than 20 A3s. And these were also the A3s you saw on the board from Kjeld. Because from management point of view, we also would like to see how far they are. And what you can see is we have very nice A3s, but also very simple ones, even handwritten, because people would like to go on and achieve things together with all the people on the shop floor. So what we try to do is that we have the responsibility for patient value as low as possible on the shop floor. And this is, I think, for this moment, we see a lot of successes on this. So one of the most important things was that we have a lack of nurses. So this is one of the biggest problems in the Netherlands. Also, we can see that nurses are moving around between all the hospitals in the Netherlands. And so what we need to do is, okay, what do we need to do to put nurses very quick to do a good, qualitative, good job? Yeah. So we totally made a new program based on the training within industry program, and also make some visible changes on the shop floor, especially for patients. Because in the beginning, we have a lot of students, like Kjeld mentioned before. Patients are asking questions to the students and they don't know the answer. So we use key change. So for now, it's possible to see for all the patients, okay, do I have a certified nurse in the room, or do we have some young graduates or students? So it's more that they know, okay, this is the kind of answer I can receive from this nurse.
It's all about expectations, actually.
So one of the other things, sometimes small, simple improvements lead to big improvements. And what we see is that there were a lot of complaining from the doctors during their visits. So the nurse is not there. Also between patients and nurses, like, okay, I would like to go for a shower. And the nurse said, okay, I don't know when the doctor is coming, so maybe you have to wait a little bit. And what we did, we make a simple agenda. So first we started off with Post-its on a white paper. And later on, we make a visible monitor where you can see that we have a daily visiting agenda. And also we put a checklist in place so that we know for sure on quality, from quality point of view, that we did the good things, also based on questions from patients. And what we see is that the result was that we have 40 minutes less needed for visits for every doctor. So this is a very big.
Every doctor, every day. So
yes.
It was a great improvement.
Yeah, and the most important thing is that the doctor, nurses, but of course patients are very happy because now they really know where they can, when the doctor will arrive. Another thing, when I started in the area where I was responsible for, is that we have 4 different specialisms, and we have different planning agencies, and they don't know from each other how to plan their patients. So what is happening is that we often have to cancel last minute when the patients are coming in, even 1 hour before. We also have stories that people are waiting for going to the surgery room, that the nurse will tell them, sorry, you have to come back. So patients are not happy with this. So we have to do a lot of rescheduling. Also, the planning agencies are calling doctors because of this, and even when they are on holiday. Also, we have to close a lot of beds because all this, sometimes we have beds available, no patients. So what you can see in on the picture with the guy who has some stomach ache, because on Wednesday, because on Friday we don't have enough people, so we have to close in the weekend. So again, a lot of problems. And what you can see is people are shouting to each other, like they're calling on the phone, put the phone down, like, okay, you have a problem, you have to solve it yourself. So
good luck.
Yeah. And also here, what we did is very simple. We make a daily stand-up, and we do this with 4 different planning departments. And every day at 12:30, they're coming together because in the morning the doctors have done their visit round, and then we know for sure when people will leave the hospital, and make it very visible. And also here, the result for this is that we have 10 more beds open with the same capacity on nurses. So this is a big improvement. And also we have more patients on the beds. At this moment, it's around 80%. And the goal is for now to reach with the same capacity to 30%. And from next week, we also have all our beds open. So I think this is a big improvement. I'm also proud on this one.
Yeah, for sure.
So more results to come.
Yeah.
So I think we have 10 minutes left. So if people have some questions, please ask. Are there any questions?
So great results, guys, and I think still a lot to do. So it's quite amazing because it's not an easy situation. What we also see in the past that, of course, patients get more and more, but also Rotterdam is not the easiest. So it's a big city with big city problems. Lots of even people with no official status. So how do you deal with it? So yeah, impressive results. Let's see if there's any questions coming in on the private chat, or sorry, on the comments. So anyone with questions or remarks? How is the people engagement coming along? Can you tell a bit about it?
I think the people engagement is essential, and it has all to do with the trust. I think because we give the nurses, but also doctors, control over their own process, the engagement goes up. if you eliminate all kind of frustration or waste, the engagement goes up. So I think our focus on operational management, make visual what your problems are, bring teams together on daily stand-ups, improves the engagement, and also does a lot in the culture, actually, because the yelling stops and there's more understanding. And actually, when the results are coming in, everybody is happy because your own work becomes easier. Patients are much more appreciated about what you do. So we see a big difference, but actually it's a lot of work. It's not rocket science, but you have to go against the flow or the traditions of so is it how we work in this place. But if you push a little bit and start experimenting and the results come in, then you have your case and everybody is involved. So I like the idea that it's not only the doctors, it's not only the nurses, but also the planners, also the facility people that clean rooms. So we are building a large community of people. They see the difference when we actually introduce lean thinking.
Sometimes it's forgotten, like if you look at the theory on how you build an OBEA room, it's most of the time it's based on safety, quality, delivery, cost. Our number one is about people.
Yeah.
So what we are doing, what can we do that other people are involved, and also what they can do to be. Also, we are working a lot on to have the people happy.
Yeah.
I think this is.
I think a major difference was that you got people out of their emails, so sending each other emails instead of just talking to each other every day on the planning, for instance. So another question is, how were you able to overcome the doctor's attitude that lean is for cars? So did you encounter that?
Yeah, I think also if you look at what I showed you on the agenda for the visiting of the doctors, because they are wasting a lot of time on waiting. So it's more like take them with you. I think one of the biggest achievements we have at this moment, that we started up with our training program, like the WAVE program we did on only with the nurses. But on the new round, we also have doctors involved. And I think this is for us, it's one of the biggest achievements we could have, because in the beginning it was more like, okay, it's only for the operational part and not for us, because we are not doing this kind of improvements or something. And now they are willing to learn.
Yeah. So what we discovered is it's all about the invitation. Can we invite you to walk a few steps together with us and see what's happening? And if you walk together the same path and they get acquainted with your language, your authenticity, that you want to solve also their problem, then the engagement starts to rise.
Well, they also have they have to face a lot of admin work. So what can we do to help you with that? And this is where we can help. Yeah.
Okay, next question, Alicia Svitkova. I hope I pronounced it well. What was the biggest obstacle? What is the biggest obstacle?
I think there were a few obstacles. I think we had a lot of yes, but ideas. We all already look at this problem several times.
We will try
this cannot work. So I think that was a problem. We have to change the thinking to get different experiences. So that was one of the obstacles. Are there more obstacles you encountered?
Yeah, if I look at what I showed you about the planning departments, when I started here, the guy I took over, he told me like, okay, I'm working on this for 5 years already. I will tell you good luck, but
Believe.
I don't think it's gonna work here. So, and now in only 3 or 4 weeks, this is what we have achieved. So.
Okay, maybe the next question. Are the nurses involved in problem definition and experimentation? So are the nurses involved?
We don't see the question, sorry. What's the
So
question?
are the nurses involved?
Yes, of course. So what we did is also for the learning part is in the beginning we asked them, okay, what kind of problems do you see in your own environment? And they started with their first A3s on their own problems. And later on, it's like, okay, you need to learn how to, it's like I can tell you in 10 minutes how to make an A3. And now, okay, now you have to do it yourself. And this is what they find very hard. But first they start with their own ideas, problems in their own environments. And later on, we try to turn them a little bit into, okay, from organization point of view, what are the biggest problems and how can you help us or together with all the layers in the organization, what is your role to solve together the problem so that we can achieve our goals?
Yeah.
What you saw on one of the slides is that we were very kind and nice about how the A3 was made. So it doesn't have to be fancy. If you want to write, it was more important that they were involved, that they were start doing things, than it's actually the right way how we do A3s. It's more about the principle and the doing than the form, how an A3 does look like. Yeah.
Okay, next question from Saskia. We saw her earlier today from the IND. How did you deal with the Dutch leadership attitude? Maybe explain a bit what Dutch leadership attitude is.
Maybe it's about discipline.
I think that discipline, accountability. I think a lot of Dutch leaders don't walk at the work floor. So actually, from an office, they think about solutions and then they try to push the solutions on the work floor. I think that's changing. Actually, I see a lot of good examples where leadership is more involved, and actually the pyramid is turning around. So it's more about people and less about management. And management is more about coaching and accountability, actually. And I think that's one of maybe an obstacle as well, because we have had to learn, our managers, that accountability is necessary to get results. So all understanding why it's not working, your countermeasures are not working, that's not good enough. As a leader, you have to be ask accountability from your employees in a nice way, in an understanding way, and that will help.
Well, thanks for sharing your story. Great to see two leaders really doing the real work on the shop floor. So thank you very much. It's over to Chris.
Thank you.
Thank you. Thank you, René. Thank you.